Hello, my name is Dr. Samuel Rivers, and I've spent the better part of my life working in the healthcare field, specifically focusing on the well-being of older adults. As a geriatric specialist, I've seen countless patients navigate the complexities of aging, often battling misconceptions about health, supplements, and what's truly beneficial as they grow older. After decades of research and experience, one thing is clear. Many people still misunderstand the true role of supplements in senior health. I remember one of my first consultations with an elderly couple, both in their late 70s, who were taking an overwhelming number of supplements because they thought more was always better. One of them, Mrs. Green, had been taking a dozen pills a day, convinced that it would keep her joints healthy and boost her energy. Yet, her health wasn't improving. In fact, she was experiencing digestive discomfort and fatigue. After a detailed review, we discovered that many of the supplements she was taking were not suited to her body's needs, and some were even counteracting the benefits of the others. I explained to her that proper supplementation isn't about quantity, but quality and balance. This is just one example of the common misunderstandings that I see every day. Many people think that all supplements are harmless and that they can simply pick up any bottle off the shelf without considering the specific health conditions they may have. Unfortunately, this is not the case. Certain supplements, if misused, can lead to complications, especially for older adults who may be managing multiple chronic conditions. Now, let me ask you, have you ever wondered whether the supplements you're taking are truly working for you? Maybe you've noticed no improvement, or worse, experienced side effects like dizziness, upset stomach, or increased fatigue. You're not alone. Many seniors struggle with this exact dilemma, but don't worry, I'm here to guide you. In this video, I'm going to break down the most common misconceptions about supplements for older adults, how to choose the right ones, and the best ways to use them effectively for maximum benefit. By the end of this video, you'll have a clear understanding of which supplements actually support your health and which ones to avoid. Are you ready to take control of your health and finally feel confident in your supplement choices? Stay tuned and let's dive in. I promise you, the solutions I'll share today can make a world of difference in your daily life. As I continued my work with Mrs. Green, I began to realize just how common misunderstandings about supplement timing are among older adults. One issue I frequently encountered was the incorrect timing of vitamin C, calcium, and iron supplements. Many people believe that if they take multiple vitamins or minerals together, they'll get the maximum benefit. Unfortunately, that's not always the case. Let's talk about vitamin C, for example. It's widely known for boosting the immune system, improving skin health, and acting as an antioxidant. And while vitamin C is extremely beneficial, many seniors don't realize that it can interfere with the absorption of other important nutrients when taken at the same time. One of the most common mistakes I see is taking calcium and iron supplements together, as many people think it's a simple way to get both in one go. However, what they don't know is that calcium and iron actually compete for absorption in the digestive system. When you take them together, your body is likely not able to fully absorb either one effectively. In fact, calcium can interfere with the absorption of iron, potentially leading to iron deficiency over time. This is particularly problematic for older adults who may already be at risk for low iron levels due to conditions like anemia. I recall a patient, Mr. Thompson, who had been feeling fatigued for months. He was taking both calcium and iron supplements every morning with his breakfast, believing that this would strengthen his bones and improve his energy. After reviewing his supplement routine, I realized that the combination of calcium and iron might be hindering his body's ability to absorb both nutrients. After making some adjustments to his regimen, including spacing out the two supplements, he began to feel more energized and noticed an improvement in his overall health. So, what's the best way to take these essential minerals without running into absorption issues? Here's a simple tip that can make a huge difference. Always try to take your calcium and iron supplements at least 2 hours apart. By doing so, you give your body the time it needs to properly absorb each nutrient, allowing you to reap the full benefits of both. For example, you might take your iron supplement with a glass of water in the morning and then have your calcium supplement later in the afternoon or evening. And don't forget, if you want to maximize the absorption of iron, it's best to pair it with vitamin C. Vitamin C can actually help increase the absorption of non-heme iron, the type found in plant-based foods and supplements. So consider taking a vitamin C supplement or having a food rich in vitamin C, like an orange or bell pepper, along with your iron. Remember, it's not just about taking the right supplements, it's about taking them in the right way. The timing and combination of supplements play a critical role in how effectively your body can use them. I know navigating the world of supplements can be confusing, especially with so much information out there. That's why I'm here to help guide you every step of the way. In the next part of this video, we'll go over other common mistakes seniors make when it comes to supplement use and how to fix them. Before we continue, if you found this information helpful, don't forget to hit that subscribe button and join our community. By subscribing, you'll never miss out on more expert advice that can help you live a healthier, more vibrant life as you age. We've got plenty more tips coming your way to ensure you're taking the best possible care of yourself. After discussing the importance of timing with calcium and iron supplements, we continued our conversation about supplement mistakes, and Mrs. Green seemed eager to learn more. We had already covered a few fundamental points, but I could see there was still some confusion in her eyes when it came to taking vitamins. Dr. Tori Four. Lawson, she said, I've always heard that vitamins are essential, but sometimes I feel a little queasy after taking them. Is there something I'm doing wrong? That's when I knew I needed to address another common mistake. I see so often in my practice taking vitamins on an empty stomach. Many older adults, like Mrs. Green, have been taught that vitamins should be taken as soon as they wake up, often on an empty stomach. While the thought of starting your day with a vitamin boost seems like a healthy habit, the reality is it could be causing more harm than good, especially when it comes to fat-soluble vitamins like A, D, E, and K. You see, vitamins A, D, E, and K are fat-soluble vitamins, which means they require fat in your diet to be properly absorbed by your body. If you take these vitamins without any food or fat in your stomach, your body won't be able to absorb them effectively. Not only will you miss out on their benefits, but you may also end up feeling nauseous or uncomfortable. I've had patients tell me they feel dizzy or queasy after taking vitamins in the morning on an empty stomach. This is exactly why it's so important to take vitamins in the right way. I shared this information with Mrs. Green and mentioned the time I had a patient, Mrs. Carter, who was consistently feeling sick after taking her vitamin D and vitamin E supplements first thing in the morning. After some discussion, we realized she was taking her vitamins on an empty stomach, with no fat to help her body absorb them. Once we changed her routine and had her take the vitamins with her lunch or after dinner when she was consuming healthy fats like avocado or olive oil, she noticed a significant improvement. Not only did she feel better after taking her vitamins, but her energy and overall health improved as well. Here's a simple tip that can make a big difference. Always take your fat-soluble vitamins A, D, E, and K with a meal or right after a meal that contains a source of healthy fats. This could be a handful of nuts, a bit of olive oil on your salad, or even some avocado. The fats help the vitamins dissolve properly and allow your body to absorb them more effectively. If you prefer to take your vitamins in the morning, try pairing them with breakfast that includes healthy fats, maybe some eggs with avocado, a smoothie with nut butter, or oatmeal with chia seeds. If you take them later in the day, try to make sure your dinner or lunch includes good fats from foods like salmon, nuts, or olive oil. Mrs. Green was amazed by how something so simple could make such a difference. I never realized that taking vitamins on an empty stomach could cause these issues, she exclaimed. I'm definitely going to make sure I take them with a meal from now on. And it's not just fat-soluble vitamins that benefit from being taken with food. Water-soluble vitamins, like vitamin C or B complex vitamins, can sometimes cause mild stomach discomfort if taken without food. So it's still a good idea to have a small meal or snack when taking them. Remember this: the timing and manner in which you take your vitamins is just as important as the vitamins themselves. Taking fat-soluble vitamins with food, especially foods containing healthy fats, will help your body absorb them properly and avoid any uncomfortable side effects. It's a simple yet effective way to make sure you're getting the most out of your supplements. After we had discussed the importance of proper timing when taking vitamins, Mrs. Green seemed much more confident about adjusting her supplement routine, but there was still one more important topic: to cover the dangers of taking too many vitamins, especially fat-soluble ones like vitamins A, D, E, and K. Dr. Durseth, Lawson, she asked, I've heard that some people take huge amounts of vitamins thinking it's good for their health, but is there such a thing as too much? I'm worried that I might be overdoing it with my supplements, I nodded, recognizing that this was another common mistake I see quite often, particularly with older adults. Excessive vitamin intake can actually do more harm than good, and it's something many people don't realize. Unlike water-soluble vitamins, which the body excretes in excess, fat-soluble vitamins A, D, E, and K are stored in the body, particularly in the liver and fat tissues. This means that if you take too much of these vitamins, they can build up over time and lead to toxicity. Vitamin toxicity is serious and can cause a variety of health issues. For example, excessive vitamin A can lead to liver damage, blurred vision, or even bone fractures. Too much vitamin D can cause calcium buildup in the blood, which can damage your kidneys and heart. High levels of vitamin E may interfere with blood clotting and cause bleeding problems, and too much vitamin K could interfere with blood-thinning medications. I shared with Mrs. Green a story from my practice. A few months ago, I had a patient, Miss Taylor, who had been taking large doses of vitamin D every day because he thought it would help with his bone health. He had heard that it could help with osteoporosis, and since he was concerned about his bone density, he decided to increase his intake. After several months, he began to feel fatigued, weak, and had frequent kidney issues. After reviewing his supplements, we realized he was taking far more vitamin D than was safe. Once we adjusted his intake to the recommended levels, his symptoms improved and his kidney function returned to normal. This is why I always tell my patients moderation is key. It's easy to get caught up in the idea that more vitamins equal better health, but in reality, too much of a good thing can be harmful. The key is to follow the recommended dosage, which is typically listed on the supplement bottle or provided by your healthcare provider. Here's a crucial tip for everyone. Always stick to the recommended dosage for each vitamin and supplement. If you feel the need to increase your intake for any reason, whether it's for bone health, immune support, or anything else, always consult with your doctor or a nutritionist first. They can help you determine the right amount based on your individual needs, health status, and any medications you may be taking. Remember, vitamins A, D, E, and K are important for your health, but they can also accumulate in the body and cause serious problems if taken in excess. It's always better to err on the side of caution and stick with the recommended dosage. Your body will thank you for it in the long run. Mrs. Green was relieved to learn that managing her vitamins didn't have to be complicated. I had no idea I could take too much and actually harm myself, she said, shaking her head. I'll definitely be more careful from now on and make sure I stick to the recommended amounts. And that's the beauty of taking control of your health. It's about finding balance and listening to your body. It's important to remember that supplements are meant to complement a balanced diet, not replace it. The best way to get the nutrients your body needs is through a varied and healthy diet, with supplements filling in the gaps when necessary. As we sat down to continue our conversation, Mrs. Green leaned forward with curiosity in her eyes. Dr. Lawson, I've been thinking about something. What if I've been taking supplements that my body doesn't even need? I mean, I've heard that some people need more vitamin D while others don't. How can I be sure that I'm taking the right vitamins for my body? I smiled, knowing that this was a very important question. You're absolutely right, Mrs. Green, I said. This is one of the biggest mistakes I see in my practice. Taking vitamins without knowing the condition of your body is a serious risk. It's easy to assume that we all need the same supplements, but the reality is that everyone's needs are different. For example, some people may have low vitamin D levels, especially as we age or live in places with limited sunlight. On the other hand, others might already have sufficient vitamin D, and supplementing could create an imbalance in their body. Mrs. Green looked thoughtful. So, if I take vitamin D without knowing whether I need it, could it be harmful? Yes, it could be, I replied. Vitamin D is crucial for bone health, immune function, and more. But if you take too much when your levels are already adequate, it could lead to toxicity. Excessive vitamin D can cause calcium buildup in your blood, leading to issues like kidney damage, nausea, and fatigue. That's why it's so important to know your vitamin levels before you start supplementing. She nodded, now understanding the importance of getting the right amount. I continued, that's why I always recommend that people get a blood test to check their vitamin levels before starting any supplementation, especially for vitamins like vitamin D, B12, and iron. Your doctor can then assess whether you need to supplement and how much is appropriate. Without that information, you might end up with a deficiency in one area or an excess in another, which can throw your body out of balance. Mrs. Green's eyes widened as she took in the information. So, it's not just about picking a random vitamin and hoping for the best. Exactly, I said. It's about being intentional and informed. The goal is to find out what your body truly needs based on your diet, lifestyle, and any health concerns you may have. You wouldn't take a medicine without knowing exactly what it does to your body, right? The same applies to vitamins and supplements. They're powerful tools for your health, but only when used correctly. I shared an example with her. A patient of mine, Mrs. Carter, came in recently with complaints of feeling sluggish and tired all the time. She was taking high doses of vitamin D because she'd heard that it would improve her energy. But after a blood test, we discovered that her vitamin D levels were already within the normal range. What she actually needed was more iron and vitamin B12, as her levels of both were low. She had been supplementing with the wrong vitamin, which hadn't helped her feel any better. Mrs. Green nodded in agreement, impressed by how a simple blood test could reveal so much. I never realized how important it is to know your body's current state before starting a supplement regimen. So it's crucial to check your levels first. That's right, I said. Before you start any vitamin supplements, always consult your doctor and get a blood test to check your vitamin and mineral levels. Once you have that information, you can make an informed decision about which vitamins you need and the appropriate doses. It will save you time, money, and, most importantly, help you avoid any potential harm. I could see that Mrs. Green was already thinking ahead. I'll make sure to get that blood test soon. Dr. Lawson, she said with determination, I want to be sure I'm doing everything I can for my health. The right way. Great decision, Mrs. Green, I replied, smiling. And remember, supplements are just one piece of the puzzle. A balanced diet, regular exercise, and stress management are all just as important. If you ever need help or advice along the way, don't hesitate to reach out. As we continued our conversation, Mrs. Green leaned in with a concerned look on her face. Dr. Lawson, I've been reading a lot about vitamins lately, and I'm starting to wonder, how can I be sure that the vitamins I'm taking are actually good quality? I've heard so much about fake supplements and products that may not be as effective or even safe. How can I tell if I'm making the right choice? I could tell this was a valid concern. The supplement market is flooded with products of varying quality, and many people, especially seniors, can easily fall victim to buying products that aren't up to standard. That's an excellent question, Mrs. Green, I replied. It's something I see far too often. Low-quality supplements can be a real problem, especially when it comes to your health. A lot of these products are packed with additives, preservatives, and sometimes even harmful chemicals that can undermine your health instead of supporting it. Mrs. Green looked puzzled. Are you saying that some supplements can actually harm my health? Absolutely, I said. Let's break it down. Poor quality vitamins can contain unnatural additives, like artificial colors, sweeteners, and fillers. These substances are often added to improve the taste, appearance, or shelf life of the product, but they don't add any nutritional value. Worse, they can lead to stomach issues, allergic reactions, or interfere with how the body absorbs the nutrients. I continued. And, even more concerning, is the issue of incorrect dosages. Some supplements may claim to have a certain amount of vitamins or minerals, but they don't actually contain what's advertised. In some cases, the amount of active ingredients is too low to be effective, while in others the dosage is too high, which can cause toxicity or other side effects. Mrs. Green nodded thoughtfully, clearly concerned. That sounds really alarming. So, how can I avoid these bad quality products? It's all about being informed and careful about where you buy your supplements, I explained. Here are a few simple tips to help you choose better quality vitamins. Look for third-party testing. Choose products that have been tested by independent organizations like the U.S. Pharmacopoeia USP or Consumer Lab. These organizations ensure that the supplement contains what it says it does, and that it's free from harmful contaminants. Check the ingredients list. Avoid supplements that have a long list of artificial colors, fillers, or preservatives. Opt for products that contain as few additives as possible and have natural ingredients whenever possible. Choose trusted brands. Stick with brands that have a strong reputation and a history of producing high-quality, safe supplements. If you're unsure, you can always ask your doctor or pharmacist for recommendations. Beware of unrealistic claims. If a product promises to do something that sounds too good to be true, like curing a serious condition overnight. Be cautious. High-quality supplements don't make outrageous promises. They focus on supporting overall health. Mrs. Green looked more reassured, but still had a lingering question. So, I need to be careful about where I buy from. But what if I've already been using some of these low-quality supplements? Should I stop taking them right away? I nodded and replied, if you've been using a supplement that you suspect might be of poor quality, it's a good idea to stop using it until you can find a better option. And remember, it's always best to consult with your doctor before making any changes to your supplement routine. They can help guide you in choosing the right products and ensure you're getting the nutrients you need without any risks. Mrs. Green smiled, feeling much more confident now. Thank you, Dr. Lawson, for explaining all of this so clearly. I'll definitely be more cautious and check the quality of the products I buy from now on. As the conversation continued, Mrs. Green leaned back in her chair, thoughtfully tapping her fingers on the table. Dr. D. Tao? Lawson, I've been following all these tips about vitamins, but I've also been hearing a lot about the importance of eating right. Is it really that important? Or can I just rely on supplements to give me everything I need? I smiled, knowing this was a crucial point. That's an excellent question, Mrs. Green, I replied. I think many people believe that vitamins and supplements can be a substitute for a healthy diet. But the truth is, supplements should never replace a balanced, nutritious diet. They're meant to fill gaps, not be your primary source of nutrition. Mrs. Green nodded, looking curious. So, you're saying that I can't just rely on vitamins? I have to eat healthy food too. Exactly, I affirmed. Your body thrives on whole foods, a healthy diet full of fruits, vegetables, nuts, whole grains, and lean proteins provides not only the vitamins and minerals your body needs, but also the fiber and antioxidants that are essential for long-term health. Supplements can help, but they should be just that, a supplement to a good diet, not the cornerstone. I could see Mrs. Green processing this new information. So if I eat the right food, I might not even need as many vitamins. Right? That's right, I said, leaning forward. For instance, vitamin C can be found in plenty of fruits and vegetables, like oranges, kiwis, and bell peppers. And if you're looking for vitamin D, getting some sunlight and eating fatty fish, like salmon or mackerel, can do wonders. A lot of people don't realize that the best source of vitamins is often the food you eat on a daily basis. I paused for a moment before continuing. Another thing to keep in mind is that nutrients in food work together in ways that supplements can't always replicate. When you eat a balanced meal, the vitamins and minerals in your food support each other, and your body absorbs them more efficiently. Supplements, on the other hand, may not have that same synergistic effect. Mrs. Green was taking all of this in, but what if I'm too busy or don't always have access to healthy food? That's a common concern, I said. Life can be hectic, and sometimes healthy food isn't as convenient as we'd like. But I'd recommend trying to make small, practical changes. For example, keep fresh fruit on hand for a quick snack, or prepare simple, balanced meals with lean proteins, whole grains, and plenty of vegetables. And when you can, try to cook at home this way. You have more control over what you're eating, I continued. If you absolutely can't get everything you need through food, that's when supplements can be helpful. But remember, whole foods should be your first line of defense. Before thinking about buying a bottle of multivitamins, start by focusing on eating a well-rounded diet. Mrs. Green smiled, clearly feeling more confident. I guess I've been focusing too much on the supplements and not enough on the food I eat. I'll start making healthier choices and see how I feel. That's exactly the right approach, Mrs. Green, I said with a smile. And remember, if you need more guidance, I'm always here to help. Keep an eye on your overall nutrition and make sure you're giving your body the best possible foundation to thrive. Before she left, Mrs. Green asked, "And if I still need some extra vitamins, what should I do?" "I'd suggest starting with natural sources." I said, "But if you need to supplement, make sure you choose high-quality products. And always check with your doctor first. It's all about finding that balance." In today's video, Dr. Charles Lawson, a renowned expert in senior health and wellness, shared essential insights about the common mistakes many seniors make when it comes to vitamin supplementation. His advice is not just practical but life-changing, especially for those looking to live healthier, more vibrant lives as they age. One of the most profound lessons from today's video is that while vitamins and supplements can play a vital role in maintaining good health, they should never replace a well-balanced, nutrient-rich diet. The best way to support your body's needs is by first focusing on whole foods, fruits, vegetables, lean proteins, and whole grains. Supplements should be considered as a supplement, not a substitute. Quality over quantity is key. Whether it's vitamins or the food you consume, Dr. Lawson also reminded us that it's essential to listen to your body and not just blindly rely on supplements or popular advice. For example, knowing which vitamins your body needs through blood tests and consultations with healthcare professionals can prevent potential deficiencies or overdoses. It's all about making informed decisions and ensuring you're giving your body the nutrients it truly requires to thrive. Additionally, the concept of balance and health becomes even more significant as we age. The synergy between diet, physical activity, and proper supplementation is the foundation of long-term wellness. As Dr. Lawson emphasized, taking care of your health doesn't have to be complicated. Small adjustments in daily habits, like choosing whole, nutritious foods and being mindful of when and how you take supplements, can make a world of difference in how you feel. Embrace this holistic approach to wellness, and you'll see benefits not just in your physical health, but in your overall well-being. Before we wrap up, I'd like to encourage you all to like this video and subscribe to the Senior Moments Matt channel for more valuable insights from Dr. Charles Lawson and other experts. I'd love to hear from you. Please share your thoughts on today's video. Did it help you rethink your approach to supplements and nutrition? Leave a comment with your personal experiences or any questions you may have. Let's start a conversation and learn from each other.